I beg to move that this House has considered e-petitions 575-801, 577-842 and other associated e-petitions relating to COVID-19 vaccination. I'm glad that we have another opportunity to discuss vaccinations in this House, and I'd like to begin by thanking the NHS, pharmacists and volunteers in Carshalton and Wallington, but across the UK, for making our vaccination programme such a huge success. And I'd particularly like to thank Rena from SG Barai Pharmacy in Carshalton and Wallington for administering my own COVID-19 vaccinations. I'd also like to start by very much welcoming the Minister to her place today. I believe this is her first debate that she's responding to as Minister, and I've always found her to be nothing but courteous and friendly, so I wish her all the very best in her new role. Mrs Garney, I would like to draw the House's attention to the Government's responses to these petitions, which I think sets out very clearly that the Government is indeed thinking very carefully about matters such as certification and vaccine status, and considering all issues prior to making a decision. And I'm sure the Minister will want to elaborate on those responses in her response to today's debate, so I'll not steal all her material. But as this debate gives us an opportunity to discuss vaccinations once again, I would like to use the opportunity to urge everyone to book their slot for vaccinations as soon as they possibly can. And I particularly welcome the news today that we are beginning our booster jabs programme, something that I'm sure, again, the Minister will want to touch on a bit later. But, Mrs Garney, it's true to say that COVID has not gone away. Whilst we are unlocking and whilst we are rediscovering many of the freedoms that we have sacrificed over the last 18 months, people are still being hospitalised and are still dying from coronavirus. And I think the data here speaks very much for itself. The majority of those being hospitalised and the majority of those who are dying from COVID-19 are those who have not been fully vaccinated. So it's clear that by getting vaccinated, we're not only protecting ourselves, but others too, and are playing our part in bringing an end to this pandemic. Because vaccines truly are a marvel of modern medicine. One that we can be proud was discovered by a Brit, Edward Jenner, who demonstrated that with a mild infection with a cowpox virus, conferred immunity against the deadly smallpox virus. And cowpox did indeed serve as the natural vaccine for smallpox until more modern vaccines were brought out in the 19th century, which laid the groundwork for the system of vaccinations we know today. And smallpox remains the only virus considered to be eradicated internationally since 1980. Now, since Jenner's discovery of vaccines as we know them today, vaccines have been developed and helped to offer immunity to a whole range of viruses such as measles, mumps, rubella, influenza, tetanus, polio, diphtheria, yellow fever, rabies, hepatitis, polymyrovirus, meningitis, and so many more. It is easy, therefore, I think, to take vaccines for granted. But I would just like to invite the House to consider for a moment just how much of an impact that vaccines have had on the world. These illnesses are things that would have once struck dread, fear, and anguish into the hearts of the patients who were diagnosed with them. Yet today our lives are quietly unaffected. Unaffected by these horrors, we just go about our day unworried by them, by a seemingly simple concept of a jab which is over in a matter of seconds, which allows us to carry on our lives protected and healthy. And these miraculous vaccines must pass extremely rigorous testing before they are licensed for use in the UK. According to the Oxford Vaccine Group, the following are just some of the stages that a vaccine has to go through before use. It includes a literature review to review what has been done before, a theoretical development or innovation, coming up with a new idea or varying on an existing one, laboratory testing and development involving in vitro testing using individual cells and in vivo testing, which often uses mice. This then must go through 3 stages of human trials before licensing and reviews, and then continues to be monitored after its approval for wider use to take note of any new developments. And COVID-19 vaccines have been no different. They've had to go through this same testing criteria. Yes, there have been questions about speed, but Dr. June Rain, the Chief Executive of the MHRA, has explained perfectly clearly how the UK was in particularly able to approve this vaccine so quickly. So my message to anyone who still has apprehension about getting their COVID-19 is please, please, please do speak to your GP or your pharmacist to get the facts. And this is an important point. Speak to the professionals with the years of knowledge and training. Now, we've all had a bit of a laugh over the last week and a half about Nicki Minaj and swollen testicles, something that I never thought Mr. Carney I would say in the House of Commons. But it does raise a very serious issue. The rates of vaccination drop as you go down the age groups, and it's important that the government is finding ways to reach younger people, to encourage them to protect not only themselves, but others around them by getting the vaccine, especially when they are being fed misinformation, downright lies, and mad conspiracy theories by people with hidden agendas in the pockets of well-funded and well-organised anti-vax movements. So I agree with Professor Chris Whitty that these people are preventing someone from getting the potentially life-saving vaccine, and they should be utterly ashamed of themselves. So my message, Mrs. Carney, is to urge everyone to speak to their doctor, to get themselves vaccinated, protect themselves and those around them, and help bring an end to this awful pandemic.